Autoimmune hemolytic anemia is a disease where antibodies produced against red blood cells and that coat the red blood cells cause destruction of these red cells through the macrophages, and the antibodies are created by B cells. We know that the SYK pathway is important in both of these processes. So the Fc gamma receptor activates through the SYK pathway, so macrophages would be activated through this to destroy red blood cells, and the B cell receptor also works through the SYK pathway. So inhibiting the SYK pathway has potential to reduce macrophage activation as well as B cells activation, so dual parts of autoimmunity. And we know that fostamatinib works in immune thrombocytopenia, so another autoantibody-mediated disease for which fostamatinib is now licensed. So we're very hopeful that actually this will be a very targeted treatment for these patients with a rare condition that really is very frustrating to treat. So there are currently no approved treatments for warm autoimmune or hemolytic anemia, which is a rare but potentially serious disorder. And the disease is characterized by autoantibody-mediated phagocytosis of red blood cells in the spleen tyrosine kinase-dependent signaling pathway. And fostamatinib is a potent oral SYK inhibitor, which is approved now for the treatment of chronic ITP, which has a similar SYK mechanisms to warm autoimmune hemolytic anemia. And we also know that in a mouse model of autoimmune hemolytic anemia, mice injected with anti-red cell antibodies displayed anemia, whereas those pre-treated with fostamatinib were significantly protected from anemia, and this is already published work. In a phase 2 open label study, 12 of 25, so 48% of patients with warm autoimmune hemolytic anemia had a response to fostamatinib, that is a hemoglobin greater than 10 grams per deciliter, with an increase of greater than 2 grams per deciliter from baseline without use of therapy. So therefore, this really gave us a good indication to start the phase 3 study of fostamatinib. So a phase 3 randomized double-blind placebo-controlled study is now underway for investigating the role of fostamatinib in autoimmune hemolytic anemia. It is a placebo-controlled study where patients are randomized 1-to-1 to either placebo or fostamatinib treatment. The dose is 100 milligrams twice a day, increasing to 150 milligrams twice a day if needed and if tolerated. And our endpoint is a hemoglobin response of greater than 10 grams per deciliter with a greater than 2 grams per deciliter increase from baseline without rescue medication. So far until July 2020, we have recruited 43 patients, and 17 of whom have completed the initial 24-week treatment period. So over the next year, we anticipate achieving our approximate 90 patient enrollment, which hopefully will allow us to really understand whether fostamatinib is a useful treatment in patients with warm autoimmune hemolytic anemia. We're very excited to see the results of these studies some point next year.